Welcome everyone. My name is Brittany Miller with Raising Special Kids, and I'm so excited for today's Facebook Live session. For those just coming on, welcome to our Here with Families, Here for Families Facebook Live. We have an awesome topic today. I'm so excited. We have some special guests I'm going to introduce to you all in a few minutes, but thank you for joining us. We are thinking of our families. We hope you guys have had a good week. As a way of an update for Raising Special Kids, as usual, we've been busy helping families. Please note, if you head over to our website at raisingspecialkids.org, we have updated all of our trainings. And so we have all different types of classes, IEP trainings, 504 plans, positive behavior support, you name it, for you to register for virtually all through the end of May. So please check that out. We've also are in the thick of our Arizona tax credit campaign. So if that is an easy way that you can support the organization. If you would like to do so, we will put that information in the comments. So thank you again for joining us. I'm really excited. As you've probably seen as we've been advertising this week, we are going to be talking with two gentlemen from DDD, the Department of Developmental Disabilities, and from Arizona Long-Term Care. So welcome, David Silverstone and Shawn Thompson. Thank you so much for being here today.
Thanks for having us.
Hello, everyone.
Hi.
So before we get started, I'm going to give a little background to our viewers to let them know what your areas of expertise are. So Shawn Thompson is the Division of Developmental Disabilities Community Outreach and Engagement Coordinator. Shawn has previously worked as a support coordinator, an eligibility supervisor, and a support coordination supervisor for the division since he began his career in 2013 after graduating from Arizona State with a Bachelor's of Sciences in Psychology. And then David Silverstone is currently a medical pass assessor for Arizona Long-Term Care. David has previously worked as an investigator for the Adult Protective Services and a support coordinator for DDD. David has proudly been working for the great state of Arizona since 1999. Thank you so much for taking the time out of your busy schedules to come on today and talk about these important subjects with our families. I know as we've been advertising it this week, we've been getting a lot of comments and a lot of parents just grateful to learn from you and to learn and share your wisdom. So thank you so much for being here today.
Thanks for having us. Appreciate it.
Sounds
good.
Thank
you very much. It's a pleasure to be here.
Thank you. Well, let's get to it, guys. So we have collected some questions and I know you guys have seen them. And for parents listening in, I am watching the chat. So if there's a question you have, if we can get to it, I've already asked them ahead of time if we can ask questions, and we will. So I will be watching that. So feel free to share this on your Facebook timelines, comment with questions you have, and we'll get started. So many of our families have children who qualify for DDD or ALTCS, as we like to call it for short, the Department of Developmental Disabilities or Arizona Long-Term Care. And can you guys explain the functions, how they work together, the purpose of each agency and then how they work together?
You want me to start on that one, David?
Yeah, you can start. Absolutely.
Perfect. So the trick here with this is the DDD and ALTCS are actually two separate agencies. So the Division of Developmental Disabilities, we handle a lot of the assessment and the case management portions. We assign the services in our focus system, and we provide all the communication essentially, and sort of the working into getting those kiddos to those services. Whereas ALTCS is the Arizona Long-Term Care System. They're who we refer to when we feel there is a member who has a necessary need for those services. David, would you like to expound?
And when that referral comes over to us, our side is a lot more simple as far as long-term care or ALTCS goes, is we're just the federal funding source for those services through DDD. So if you were, for instance, getting speech therapy, occupational therapy, physical therapy, rehabilitation, something like that, we would be the funding source for those therapies and rehabilitation or whatever you may be potentially getting through DDD. And that's how they link together.
Perfect. Thank you for clarifying that. When families call in to us at Raising Special Kids, that's often a huge question. My doctor said I should apply for DDD for my child. I have one of the considered diagnoses, so I'm going to go ahead and apply. And they don't realize that there's a step 2 often that they need to go through. So I'm glad you kind of separated that so families can understand. And we will put some resources in the comments. We'll put DDD's website. We'll put some resources that we've collected from Shawn and David. So make sure to check the comments for those listening in. So what potential services are offered for individuals that are DDD and ALTCS eligible?
So, go ahead.
Oh, no, I was going to say, since that falls more on your side, best is, yeah.
Yeah, definitely. So the way we look at it at DDD is there's 3 levels of separate eligibility when it comes to DDD services. We've got our first eligibility level, which is DD only, which means they have that diagnosis, they have the functional limitations that match and sort of show those difficulties in relation to the diagnosis. And so that's our DD only section of eligibility. They don't have necessarily the medical or the financial eligibility portions through access yet. Our secondary level would be our targeted case management. They would end up with one of our 7 access complete care plans. And that means that they're financially eligible for the access portion of the health insurance, which means they receive the behavioral health, the physical health services all through that access plan. But they won't necessarily receive DDD or ALTCS level services. So once they end up ALTCS eligible, which is our 3rd level of eligibility, which is the DD eligibility plus the ALTCS eligibility, it means that they've passed that medical assessment through David's agency, as well as our eligibility requirements through the division. So once they're ALTCS eligible, they'll have access to services in like speech, physical, and occupational therapy. We're looking at habilitation, residential services like adult developmental homes or child developmental homes, group homes. We look at we work pretty closely with VR, vocational rehab, as well as RSA, the Rehabilitation Supports Administration, to make sure that we also offer employment services. The only thing that really doesn't run through DD necessarily would be behavioral health services. So we look at basically everything else.
Okay. So can I add a question there? So if a family has access, and they wouldn't go through their support coordinator if they wanted to utilize their behavioral health benefits, would they just call their insurance and figure out what agency they're assigned to?
Yep, they can actually call the number on the back of the card and they should give them availability and services in the near area.
Okay. David, did you have anything you'd like to add?
He summed it up pretty good. Again, we're just the funding source. We don't actually offer services. So above and beyond the initial meeting where we do the PASS assessment, you'll only see us for the yearly reassessment to ensure that if it's DD, in this case, that the kid or the child would still be eligible for long-term care. And if it was on the EPD side, if the individual wouldn't necessarily be DD at that point, but just to make sure that the person is still eligible. So we don't necessarily case manage like with the support coordinator where you see them every 3 months or whatever. It's just a yearly reassessment for us. So no services, just the funding source. And as far as case management, you just see us once a year.
Okay. And so essentially Arizona long-term care is health insurance. So it's paying for the services DDD approves, but they also get the insurance part of it where they cover their medical care. Is that right?
Yeah, we're just the state's Medicaid. So yeah, Title 19 services go through us. We're just the funding source, and that's it.
Okay, thank you. So you guys have kind of talked about this, but do you have to apply for both DDD and long-term care to get services?
Depends on the service, honestly.
Yeah, if you're looking for those DDD services, then yeah, you'd need to initially apply for DDD. Have one of the, sorry, don't want to steal your thunder here, for one of the 4 qualifying diagnoses. And then if you're DD eligible, then you would apply for Arizona long-term care. But on our end, depending on what situation, what's happening in your life, you can be long-term care eligible and not DD eligible. We can go into more of that later. But as far as our side goes, that's how it works.
Okay. Did you have something you want to add, Shawn?
I was just going to echo him and say that it's along those lines of those eligibility levels. So if they're DD only, they wouldn't necessarily get those ALTCS supports, or if they were TSC, they might get the behavioral health supports and all the access healthcare supports, but they wouldn't necessarily get the ALTCS supports.
So if I'm understanding that's right, it's all dependent on if they have one of the 4 diagnoses you consider, and then they have an assessment where you figure out if they have, the functional limitations needed for DDD. But then they would need to apply for long-term care if that's something they might be eligible for, and then go through their assessments process, which I know we're going to talk about a little bit more. Is that right?
Yeah, and I would just add on to that as well that the assessment portion, when we look at our documentation for eligibility, we're looking for that qualifying diagnosis, obviously. And then when we look at the documentation for substantial functional limitations, we can use school reports, we can use doctor's visits, we can use any sort of that kind of documentation. It's not necessarily an assessment on our end so much as just kind of finding that clinical evidence for those documents.
Thank you. And for families listening, and if you go to the Department of Developmental Disabilities website, I believe it's under their eligibility section. They have all of that listed, and it's very parent friendly and easy to navigate. So I definitely encourage you to check it out. We did have a question in the comments. One parent asked, David, you said DD. Is there another ALTCS? And I'm wondering if she thought maybe EPD, which we're going to talk about in a minute. But I think in the special needs, parenting community, I think DDD is more common than DD. That's the acronym we often use.
Yeah, sorry, that was on me. We sometimes refer to DDD as DD. So yeah, sorry about that.
No, it's totally fine. But we are going to talk about EPD for Barbie, the question that you asked, in just a few minutes. So stay tuned for that. So this question would be for David. Can you talk about the eligibility process for Arizona long-term care? What might that look like?
Well, whether or not you're applying for DDD services or EPD services, the application process is the same. You'll start the application process by either picking up the phone or faxing or coming into the office, or printing and mailing in your application, and then the first person you'll speak to will be a financial representative who will make sure that either the child or the individual is financially eligible. And then once the ball is rolling on the financial side, then the application will come over to, the medical will be submitted. And then a medical PASS assessor, such as myself, will get in contact with you and schedule the PASS assessment or the pre-admission screening process, which is just a battery of questions. So that's kind of how the process gets started. If there's any other questions about how far, we can go quite a ways into that, or that's just kind of the basics of how it starts.
Yeah, so I actually have a question because we get this a lot at Raising Special Kids. So you mentioned the financial portion. A lot of parents is long-term care based on, my income, like the standard access plans are. What does that exactly mean for a child to be financially eligible? Are they only allowed to have a certain amount of money in their name? How does that work?
So on the financial side, I believe, because I'm on the medical side,
okay. Put you on the spot, sorry.
I don't believe that it's based off of the parent's income. The only issue a child could potentially run into, I believe, is if there was a trust or something like that, then there could potentially, and again, if whomever has that question, if they need some specifics on that, they can email me, or I can find out exactly what's going on there, or just let you guys know in general. But I do not think that it's based on the parent's income. It's just solely on the child. And of course, most children, your 5-year-old probably hasn't worked yet. So, there's not a lot to go, potential issues to come up on the financial side. So yeah, I do not believe it's based on the parent's income. And like I say, unless there was a trust or some other potential issues financially, that there generally isn't an issue on the financial side for the kiddos.
Okay, that makes sense. So we did have a question, and I know we're going to talk a little bit more about, you keep saying this PASS tool and what it means. But Vicki asked or shares that lately it seems as though MET reports are weighing in as part of this assessment for ALTCS. The educational evaluation results, they're being used more often in the ALTCS process. Are you seeing that?
As far as on the medical side, we've always try to gather as much information as we can. MET, IEP, DDD, when they of course will send us the ISP and any medical documentation that we can get. So as far as it being weighting more heavy now than before, no, it's generally the same. We get as much information, as much documentation as we can. And the reason for that is because when we have the assessment or the PASS that we'll talk about, the field data that we get from the parents needs to, obviously, so there'd be the field data and then the medical documentation, which should match up. So, and along the lines of everything we get from the school, whether it be the IEP, so it should all generally say about the same thing. So I wouldn't say that it's weighted anymore now. It's just something we've always looked for, something we're always trying to get with the IEP and everything else.
Thank you. So would you mind elaborating a little more on the PASS tool? You know, what exactly is a PASS tool, and what does it mean for families? A lot of families call us and they're like, I have this certain number, and did I pass? You know, and so what exactly does that mean as far as, you know, going through that with your child?
Sure. So if you're applying on we'll start with the DDD side first. So if you're applying for a DDD pass, the tool that we use, well, there's 3 different tools we could use. There's the 0 to 5 tool, the 6 to 11, and then the 12 plus tool. What they may have been talking about as far as numbers, with either they're talking about the time marker numbers or the, let's start with the time marker numbers. So the 6 to 11 tool and the 12 plus tool, those questions never change. So no matter where you are, so if you're 6, 7, 8, 9, 10, 11, the questions will always be the same. The 12 plus tool, if you're 12, 13, 14, 15, those questions, they stay the same as well. On the 0 to 5 tool, we have what's called time markers, and I'm gonna look off screen here real quick because there's a bunch of them. So the time markers we have, and this will all make sense in a second, I promise.
This is really good while you're looking. You know, we have a lot of parents that say, you know, are they evaluating my child against, you know, what typical development is for a certain age group? So I'm glad you're talking through this a little bit more.
No problem. So like I said, the 0 to 5 tool is the only tool where the questions are not, the questions, basically it goes as you get closer to 5, so from birth to 5, the closer and closer you get to 5, the more questions you'll get. So for example, if you're in that 6 to 9 month category, it'd be 9 questions. 9 to 12 months is 19 questions. Skipping along, 36 to 48 months is 79 questions. And then at 60 months, it tops out at 101 questions. And so how time markers are relevant is whether or not you score into long-term care on the DDD side. Basically, all of the questions that you have a points value attached to them. So they're weighted. Okay. If you have 40 points, you score into long-term care. So the reason that's relevant is because as you get closer and closer to 5, you get more and more points, and with the more and more questions. So with the more questions, there's the more potential for points. So for instance, at 36 months, you had 79 questions and you scored 35 points. So you're very, very close to the 40 point threshold, but you're not quite there. So then at 48 months, it goes up to 93 questions. So if after the child hits 48 months, and if you reapplied, you would have those extra questions, and then you could have the potential for picking up those extra 5 points, and at that point you could score into long-term care. That's just kind of roughly how it works.
Thank you. We actually get that question a lot at Raising Special Kids, and it applies to some of the comments. You know, a mother shared that her daughter is on Social Security and she was denied by ALTCS, but she is appealing. So I guess that brings up a point. You can reapply, right? But you can also appeal the decision.
Yeah. So if you do find yourself in a situation where you've applied and your child did not score in, say again, you got 35 points and you get the letter back in the mail and it says, you know, unfortunately, you know, you were not ALTCS eligible at this time. You could just, there's a little slip at the bottom of the last page and you can mail that in. And at that point, you'd be requesting a hearing. And so the way it would go would be you request a hearing, then you'll meet with the PASS assessor and the PASS assessor supervisor for what's called a pre-hearing discussion, and they'll review the PASS, make sure there were no errors in it, and then if the PASS was good and the child is still not scoring in, then you'll go to hearing. It'll go before a judge, and then a judge will review everything and make a decision on it. But the judge is not the final say. So the judge just gives a recommendation. The recommendation comes back to us, and then our director will determine whether or not they want to, you know, do an override and potentially just say, okay, we're going to make it eligible or not. And that's kind of the long and the short of how that works.
Sure. And if families listening in, oh, I'm sorry, go ahead.
I was just going to put one more thing there. So when you do request a hearing, the criteria for the program does not change. So, you know, you're still going to be bound to the same 40 points. So just simply requesting a hearing does not change the criteria for the program. The judges know that. And all that would be explained in the pre-hearing discussion. So just FYI.
Yeah, thank you. And families, you know, if you have more detailed questions about this process or you need help, please call us at Raising Special Kids. We can help you, and we'll put our contact info in the chat, but our number is 602-242-4366. And we can help you with, you know, questions about DDD, questions about long-term care, and, you know, anything you might need in relation to these agencies for your child. I'm so sorry. Go ahead, David.
I'm sorry. I just have one more thing to add.
Please do.
If you don't mind. If you do find, say your child, you've applied and you find that your child is not eligible, I always tell parents, request a copy of our pass. So before you know, I mean, of course you can do what you want. You know, you can go for hearing right away if you want. Absolutely, that's fine. But I always tell people, request a copy of the pass and read through and you know, make sure that your statements are correct. Make sure that the pass assessor wrote down what you stated. And so just reach out to your pass assessor. They'll send you a pass, whether it be in the mail or via email. They'll send it out to you. Just read through it. Just make sure you're in agreement so you know what the questions are. Just make sure the right answers are put in there. Because a lot of times, you know, maybe something wasn't written correctly, or maybe it wasn't scored accidentally. So there's a lot of little things that you could look over and just make sure that it's correct. So I always tell people to do that.
Yeah, that's very good advice. Thank you. So I have a question for both of you. We're in a pandemic right now. Are these done for DDD or long-term care? Is this in person? Are you assessing them over the phone? How does that work?
So for the DD eligibility process, for the past couple of years, a lot of it has been all just documentation based. So they need that clinical documentation to be able to provide per statute that the eligibility requirements are met. So the eligibility portion itself isn't necessarily done in person. Before the pandemic, we were meeting if they are eligible for DDD. We're meeting with them dependent on the level of eligibility, you know, every 180 or 90 days, depending on that level of eligibility. But right now, last I heard, everything was still virtual unless it was necessary for the child's safety.
Okay, that makes sense.
And for us, oh, sorry, go ahead, Shawn.
No, you're good. I was just saying, or the adult. We serve all ages.
That's right. Thank you.
And for us, we've switched to most of our passes or pre-admission screenings are done telephonically. However, you can request an in-person or face-to-face pass. I've been doing them myself. For the DD questions, well, for just the questions in general, whether or not I'm sitting in front of you, which I like, it's nice to meet people, get into the field, say hello. But the questions, they stay the same. So for instance, if I'm asking you about your child, like mobility, you know, is your child able to walk? Whether I'm sitting in front of you or whether we're doing it over the phone, it's the same question. Your answer should be the same. Sure. But absolutely, if you want to see my smiling face in person, you can request that face-to-face, and I'm happy to come out, or in a different assessor.
Okay, thank you. So let's move on. What insurance plans does Arizona Long-Term Care use? Oh,
and I pulled this up. Give me just a second here.
Okay, thank you.
Because they had recently changed. So if you're long-term care eligible, you'd choose from United Healthcare. We have Banner University Family Care and Mercy Care. Those are the three that we're currently working with.
And then sorry, go ahead.
Oh, no, go ahead, Shawn.
I was just going to say, if you're a DDD member, we're currently only working with United Healthcare and Mercy Care as our two long-term care providers.
Thank you for clarifying that. I actually was just going to ask. Thank you.
And there's one more bit to that. So if you're on the EPD side, there's going to be a component of where you live, so where you're at in the state. Oh. So for instance, Banner University Family Care, you can get Maricopa, Gila, Pinal. But say if you lived in Apache, I don't see Apache County on there. So if you were in Apache County, your choices would be United Healthcare, or same for Mercy Care, Maricopa, Pinal, and Pima. So it just, you may run into an issue on the EPD side of, you know, which area you're in dictates which plan you could have. But in most areas, all 3 plans are available, but just something to remember.
Thank you. So you've been saying EPD. So let's jump onto that, because I know a lot of our families honestly haven't heard that acronym as often as we hear, DDD. So we know that some children and adults are eligible for the Elderly and or Physically Disabled Program, EPD, through ALTCS. So can you explain what EPD is and how it supports individuals with physical and medical needs?
Sure. So for the EPD program, normally we don't get a lot of children on the EPD program. Mostly it falls into the elderly and or physically disabled. I think in the last couple of years, I've only had maybe two cases with children who fell into the EPD program, and they were both, obviously they didn't have a DDD diagnosis. They just came under the program because they were both in car accidents, both unrestrained. So there was serious spinal injuries, and that's how they came into the EPD program, because they fell into the physically disabled portion of it at that time. So generally, barring accident or something similar aside, you're looking at the elderly and or physically disabled. And for that, so for the EPD program, you need to be at what's called a skilled nursing level of care. And the easiest way to kind of think about care in Arizona is the top would be the hospital, so that's acute care. At the bottom is what's called supervisory level of care. And supervisory level of care is like, someone to help you with your medications, laundry services, cooking, cleaning, getting you to your doctor, those sorts of things. So that's at the bottom. And what we do on the EPD program, the only thing we do is the skilled nursing level of care. So the easiest way to think about skilled nursing level of care, or what that is just in relation to your activities of daily living, or so your ADLs. So the mobility, transferring, bathing, dressing, grooming, eating, toileting. You have to have hands-on assistance with those. So for like walking, for example, someone has a gait belt around your waist, they're physically bearing your weight. Transferring, someone's physically lifting you, they're bearing your weight. Bathing, someone's washing your hair, they're washing your body. Grooming, someone's brushing your hair, brushing your teeth. Eating, someone's cutting up your food for you, they're feeding you. And finally, toileting, someone's doing your wiping for you, they're transferring you on and off the toilet. So that's where we come in. So that's kind of the easiest way to explain skilled nursing level of care. And obviously there can be, that's just kind of a quick overview of how things to look for. Obviously every pass is different. It's there's no one concrete way to scoring into long-term care. That's just kind of what we look for and what skilled nursing level of care is. But that's what the EPD pass is for, because a lot of times, especially we get a lot of people coming in from out of state, maybe California or Texas, Colorado, in places where they have those supervisory level of care services. And it's just for this, as far as this program goes, it's just not something that we offer or we do. We're just set up for the skilled nursing program or skilled nursing level of care. And that's it as far as the EPD goes.
Thank you. And so, we do have families that, call Raising Special Kids, and we've helped them, and they've, gone through the DDD process. And please correct me if I'm wrong, but, maybe they didn't meet the cognitive delays or needs for DDD, but their child may have spina bifida or muscular dystrophy or, like cancer sometimes. And I know families have been able to work with ALTCS and get their children approved through EPD. I mean, is that kind of does that sound right? That kind of population, those serious medical conditions is more what EPD is for?
If they didn't have the qualifying diagnosis and they weren't, under that at-risk, the 0 to 5 there where they're at risk, yeah, you could apply for long-term care, but they'd be bound to that same 60 points and the same questions that would be on the normal EPD. So we'd be focusing on the activities of daily living and their ability to complete those ADLs. It also discusses continence, hearing, vision, and then there's a behavioral health section and then an orientation section. So the criteria, it wouldn't be the same as the DDD pass where they would be bound to the 40 points. It would be the same 60 points as if I was applying or if you were applying.
Okay.
But some children do. Like I say, I've only had a couple of cases. Thank goodness, knock on wood.
Right.
In the last couple of years. But yeah, some children they do score in on the EPD path due to physical disability or host of other issues.
Okay. Thank you. We did have a question. I wanted to ask it because we get this a lot. So if a child or an adult qualifies for Social Security based on their disability, do they automatically qualify for DDD or long-term care?
Don, do you want to start?
No, not for DD. Again, our DD eligibility is based on that one of those 4 diagnoses as well as those substantial functional limitations. We do ask about it to see if we can, incorporate it into the full picture of who this kiddo or this adult or individual is, but we don't base it on that, no.
Okay. Would that be the same for long-term care? You still have to go to the assessment just like anybody else?
Yeah, for us, there's no diagnosis or current situation that automatically makes you eligible for the program. Everyone has to go through, applying, whether it be on the DDD side, or I'm never going to use to say the extra D, the DDD side or the EPD side. Yeah, it's still the same.
Okay, thank you. And we had another question about skilled nursing. So you talked about the skilled nursing and my daughter has DDD and long-term care and has skilled nursing. So I know it can fall in either EPD or DDD. If a family feels like their child may need nursing in that level of assessment, what can they do if it's not automatically offered by their support coordinator or is it a case manager for EPD? Is that who they would connect with? Is it not as a support coordinator? Is it the time? How do they get their services approved? Who would they talk to?
So they were DDD eligible. They were getting services. They were DDD and long-term care eligible, and they currently had services in place, but they wanted extra nursing services.
Yeah, and I'm sorry, there was like a 2-part to that question. I should have broken it up. So first question, I guess let's backtrack. So for DDD, your child has a support coordinator and they help you coordinate care. Is there someone that fulfills that role for EPD?
So for us, again, we don't, and I think I know what you mean here. We don't case manage. So once you're eligible for the EPD program, say you picked United Healthcare. So the assessment that I did, so when you first applied, I met you or we did it over the phone and we went through those activities of daily living. So let's say I met with you, we did the PAST, you're eligible, you then chose United Healthcare. So what's going to happen is through United Healthcare, you're going to get assigned a case manager. The case manager is going to come out or by phone, and they're going to do a very similar assessment where they run through those ADLs, your ability to walk, transfer, bathe, dress, groom, eat, toilet, or what other potential services you may need. And based on that assessment, they're going to say, okay, you need X amount of hours of, say, like attendant care. So that's, again, like I say, we don't case manage, assign hours or anything like that. You'll just have a yearly reassessment with us. Everything else would be decided through your rep or your case manager through United Healthcare or Mercy Care or whichever program you chose.
Thank you. And so I keep getting lots of good questions. So backpedaling a little bit, I don't want to miss this one. So there is a family asking about skilled nursing. And I know that's something you have to request as a nursing assessment if your child is on DDD. So please call Raising Special Kids. We can help you walk through that process and tell you what you need to do when you're talking with your support coordinator. And then we did have a question that I think we need to ask because we get this a lot. So what is the benefit for an individual if they qualify for DDD, but not long-term care? What will they get when that support coordinator comes to visit them?
Yeah, so this is actually a question I get rather frequently. And I would say that if you're going to maintain that DD eligibility, it'll be great to be connected to DD. Have us always as the person you can reach out to for those resources, like your guys' organization, Raising Special Kids, or any of the varying developmental disability agencies out and about in the community that we are connected with.
Right.
So a lot of the internal, the community, the resources, and like David was saying, you can reapply. So if your child isn't ALTCS eligible right away, give it 6 months. These kiddos change and grow so quickly that your kiddo could either be doing amazing in 6 months or there could be some regression, and it might change the eligibility portion at that point. for them, depending on the assessment. One note, I did want to mention something real quick, because I have my coworkers making sure that I mention this as well, is for the insurance plans for DDD, we also have the American Indian Health Plan for our Native American individuals. So I have Ava, shout out to Ava Big Horse, our amazing tribal liaison, for making sure that I had that information.
Thank you. Thank you. So just to clarify that, so if a child has DDD but not long-term care, they get more community resources and, you know, a check-in to see how they're doing. And then hopefully at some point, they may be able to apply and become eligible for ALTCS, and then maybe get things like the speech, the OT, the PT, breastfit, those type of services. Is that correct?
Yep.
Okay, thank you. We had, oh, I'm sorry, go ahead, David.
Oh, I would just like to add in one thing there. Kind of adding to what Shawn said, which was very good, by the way. Say you have had an assessment and you were ineligible, or your child was ineligible, and you're thinking about reapplying, and you have those upcoming PCP appointments, you know, you're going to see your primary care doctor, or you're talking to your support coordinator. Say your child, and I'm knock on wood here because I don't want anyone's child to regress, but sure. Say your child has regressed some. So, you know, again, maybe you were at that 35-point mark. So you were close, but your child has regressed. Just make sure when you're talking to your support coordinator, or you're at the doctor's appointment, that you're telling them what's going on, so that it's getting documented. Because otherwise, because every time you apply or reapply, we're going to pull documentation from your PCP. We're going to talk to the wonderful people at DDD and get the support coordinators information. So just make sure that, like I say, when you're making those appointments, that you're letting the support coordinator know, you know, Johnny has regressed in these areas. This is what's happening now. You're getting that. You're getting it notated, and same with your PCP, or if there's you know, some behavioral health services or ABA services in there, because we can pull notes and records from anywhere. We're going to need something
Sure.
backing up that change.
Thank you. That's something that is a good reminder for families that I didn't automatically think about. So if they have DDD, they're waiting to see if they qualify for long-term care, but they have some specialists coming up that can speak to their medical needs. You know, reach out to your child support coordinator, let them know, because that may or may not determine whether they may eventually be eligible. Is that what you're saying?
It's helpful, because, like I say, if you've had one application and we've gone through the assessment, and the assessment being done in the question form, it's good for a couple of reasons. One, it tells us whether or not the child or the individual is at our level of care, and two, it takes me totally out of the equation. It's just, these are the questions, here are your statements, and based on your statements and the medical documentation, it generates a score. So it's not like I'm sitting in the home going, you know, I hear what you're saying that he can't walk, but I think he can, so I'm going to score. You know, it's just, these are the questions, I take your answers. So that's why it's super, super important that when those changes come, that, you know, you're talking to your support coordinator, and you're, especially when you're doing that yearly ISP, and you're letting them know that, hey, you know, we've had these changes, this is what's happening now, just so that it's documented. And same with anyone who's doing therapies, or, you know, your primary care doctor, just whomever you're speaking to, just making sure that, you know, you're not sitting on that information. Because a lot of parents, you know, it's kind of hard. Nobody wants to say bad things. Well, not necessarily bad things, but, you know, potentially negative things about their child. But it's just really important that, you know, when you're the good, of course, the bad, of course, and really the ugly out there, you gotta make sure it's documented.
Sure. As a parent, you know, nobody wants to talk about whether a child has delays or deficits, but you know, it's important to be honest, so that your programs, your agencies can see if there's something they can help with if they qualify. I did have a question. I know so many parents are asking, and if you have really specific questions for your child, we may not get to it today, but please call Raising Special Kids. We can help you. We can get you the resources you need, talk to you about your situation, and help you figure out, you know, what questions you have for your child. But this is something that comes up all the time. So if you don't mind, I'm going to throw a question in there, guys. Can you talk a little bit about how, and I think this would be for Shawn, how the redetermination for DDD and ALTCS work, you know, for like a child that turns 6, there's that redetermination process. Can you talk a little bit about that?
Of course, yeah. So the way we send, or kind of look at it, and I can send you a form that actually kind of goes over a lot of this for reference for you guys to have. It'll be great to pass out to families and everybody else. But it's Up until the age of 6, an individual with DDD can be considered at risk. So if that kiddo's at risk for autism or they're at risk for a cognitive disability, you know, a lot of times those kiddos kind of develop a lot of their functioning through those early years that way. So up until the age of 6, that individual can be brought in under the at-risk category if they're showing difficulties kind of related to one of those developmental disabilities. Okay. At the age of 6, we do that redetermination, obviously, and we want to make sure that, first off, they have that solidified diagnosis. So whether it be that autism, cerebral palsy, epilepsy, or cognitive disability diagnosis. And we were looking, you know, for a comprehensive evaluation from one of the diagnosticians that's approved for that per statute. And again, I can send you that reference document that kind of talks about each diagnosis and which diagnosticians work for it.
Perfect.
Then we move on to look at the substantial functional limitations, and only 5 of those apply under the age of 18, because obviously for economic self-sufficiency and independent living skills, you know, under the age of 18, they're living with their parents or in some sort of guardian state, right? So we look at self-care, you know, can that individual complete self-care tasks, brushing their teeth and their hair and all the other fun stuff like that? Can they, for self-direction, we look at, you know, can they make decisions that'll best support their healthiest lives, or can they maintain focus on tasks and things like that? We look at learning, we look at those IEPs and those METs for functioning levels, for skill sets, for goal completion, to see if they're learning and retaining those concepts. We also look at mobility. We look at if those kiddos are using AFOs, any of the fun mobility items that we can utilize for that adaptive movement, wheelchairs, braces, anything like that. We look at for mobility. And then the last one I'm thinking of here is communication. So we look at receptive and expressive communication. Can that individual receive the messages that you're giving them and also express their wants and needs appropriately? So if we have documentation, clinical documentation through all our varying sources for at least 3 of those 7 functional limitations, that's what we utilize for that eligibility portion. And then at the age of 18, obviously, we look at just mostly the substantial functional limitations because they should have that solidified diagnosis.
That was such a good explanation. Thank you. So many families want to know, you know, what are they asking me about? What does functional limitation mean? And thank you, Shawn. You made that really understandable for me and for the parents listening in. And so just to clarify, the redetermination ages are 6, and then when they turn 18, is that right?
Mm-hmm. Yep. And they'll usually start the process about 6 months early to kind of start gathering and letting the parents know and really making sure that process is well talked about beforehand.
Okay. Thank you so much. So I'm seeing our comments blow up. Everyone is so thrilled that you guys are on here and giving us some great advice and information. I did want to ask too, because I know you've mentioned some great resources that we will definitely collect and share with families. There was a question, is there some sort of, you know, flow chart, you know, especially in regards to the, you know, EPD ALTCS or the DDD ALTCS? Is there any, you know, good content online or somewhere families can go to learn more about that process, you know, after this broadcast and after they, of course, have called us and we've helped them?
Well, sorry, go ahead.
Oh, no, go ahead, please.
I was just going to say for DDD, a lot of that stuff is online, or if you want to and you'd like to speak to a live person, you can call our customer service line. And I'll make sure everybody has that information as well. But we have a customer service line that can get you to an eligibility specialist if you need to talk to somebody about documentation, that can get you to that administrative review office if you need to request an administrative review. They can answer basic questions, who's your support coordinator, any of that fun stuff. And we do have a toll-free line that I'll make sure you guys get out there for that one.
I have it memorized. Are you ready?
Oh, go for it.
It's 844-770-9500. I don't know if that's a good or bad thing, but,
yep, extension 1.
But I have it memorized.
That's our team. Shout out to the OIFA office. They're the best.
For ALTCS, is there anything like that families can find online if they're wanting resources?
Yeah, I was just looking, and our number is the 602-417-4000. And like Shawn said, you can call. If you have questions about the program, you can call and ask to speak to if it's on the medical side, you can ask to speak to a PASS assessor, because when you call the main number, every day there will be a PASS assessor working, taking calls, and there will be a financial person taking calls. So there'll always be someone there to to take your call. And as far as online resources, everything we use, our policy manuals, everything is right on our website. And I give you guys the links for that, so they should be posting that. But
yes.
And like I was telling you guys earlier, if someone's out there and, you know, if they have some questions, please feel free to email me anytime or call. Email generally works best for me because I have a ton of meetings throughout the day. So I'm bad about getting to be able to answer my phone, but I'm always here. If somebody has some questions, if they've been denied and they want to review a pass, of course, you can always review that pass with your the pass assessor who did it. Just you call us and just say you want to review it. They're more than happy to do it. But if not, I'm happy to do it as well, or just anything I can help anybody with.
Thank you so much for that offer. I know that means a lot to parents. And I will say for families, you know, I've called those customer service numbers as a family support specialist and as a parent, and they are helpful. You know, someone will get you your questions answered. So utilize them. You know, we have these resources and contact information, and often if you have a question, you can call and get it right away. And so, and thank you for being willing to share your email. I know that I've learned even more about these programs listening to you both. And I know our families that have questions really appreciate the willingness to help our community. So thank you to both of you.
No problem. I know, Shawn, there used to be a book when I was working at DDD. I think it was called Navigating the System or something like that. Is that still around?
Yes, it is. I believe I'll have to see if I can find the link. We do have that. We get new copies every year, and they sit in my office and pile up so we can hand them out to people.
Yeah. We will find that. Yeah, we'll find that.
I just remembered that.
Yeah.
It's so helpful.
Thank you. And we will, even if it doesn't happen right this second, we will find it and put it in the chat so families can look for that wealth of information. So thank you. You know, I know we could talk about this all day. There's so many good questions, but just in closing, I'm going to ask both of you this question, if you could each answer. Do you have any advice or guidance to share with families trying to navigate these systems? Is there any words of wisdom or things you would encourage families to do to best help their child?
You want to go first?
Sure. I would just say at the end of the day, you know, be patient, be compassionate. These people who are doing their best to go through the documentation, there's nothing personal about an eligibility determination. We love you guys. You know, it's you are our community, and we're doing our best every day to follow statute and procedure and make sure that we're giving you guys the best service possible. Be patient, reach out, you know, join communities, talk to Raising Special Kids, because they are amazing and they offer so many supports and services and classes on fun stuff. There's a lot out there. There really is. And if you just kind of stick your tendrils out and look for those communities, there's pockets everywhere of people willing to help, DDD or otherwise.
Thank you so much. David?
I don't think I could put it any better than that. That was brilliant, actually. I always tell people, if you're at a point where you just don't know what to do, or you know what's right, what's left, you know, I always tell people, grab a notepad, write down all the questions you want answered. And I always say do that because I know for me, anyways, it seems like every time I get on the phone with somebody and I'm trying to address something, I forget half the questions anyway. So, you know, write down all the questions you want, and just give us a call. You know, if they're financial questions, just ask to speak to somebody on the financial side, and just really ask those pointed questions, and they'll be more than happy to answer them and give you any information you need. Same for the medical side. If you've got some questions, especially if you've been denied, hopefully your past assessor has called you and discussed things, or it generally lets you know. You should know at the end of the past assessment, and by the time if you're going to be denied, by the time that letter gets in the mail, you should have had some good discussions with your past assessor, and you should know exactly what's going on. But if not, you know, give them a call, give them an email. If that doesn't work, give me a call, give me an email. Send me an email. I'm happy to help in any way. And just like Shawn said, I mean, we genuinely care about the people out there, and we're more than willing to help. Just give us a call. If you're lost, don't waste 10 years trying to look around online. Just pick up the phone, get the answers you need, and go from there.
Thank you. I know both of you are incredibly busy, so we really appreciate you at Raising Special Kids for taking time out of your busy work weeks to speak with us, speak with our families. We appreciate you, so thank you so much. And I wanted to thank the participation today. We had a ton of families and professionals commenting. There's some great resources and links on this thread. So for families listening to this now and then later when it lives on our Facebook timeline, check those resources out. The Navigating the System document is there too now. So please reach out to us if you need assistance. You know, we know that at Raising Special Kids, we get daily calls about applying for DDD, applying for long-term care, you know, eligibility, you know, what should families do? We're here to help you. So definitely go to our website at raisingspecialkids.org, fill out a self-referral form, or call us because we care about our community. We want to help. And with that, we hope everyone has a wonderful weekend, and we'll see you next time.
Thank you.
Bye, everybody.
Bye.